The government expects Health New Zealand to be delivering timely, quality access to healthcare for all New Zealanders, not making submissions opposed to McDonald's stores up and down the country. We want them to be a health service, not the health police.
But doctors fear the government's latest edict is suppressing public health expertise. On Tuesday, medical officers of health were called to a meeting which they described as chilling. In a statement, National Public Health Service boss Dr Nick Chamberlain confirmed he told those doctors that they would need national level approval before making any public submissions.
To be making submissions opposed to McDonald's shops and getting involved in public policy matters is not their role, and we've been very clear about what their role should be and what their role shouldn't be.
So that was half of the story from last night, mostly wanting to having a look at those things from Simeon Brown. I do want to get some specifics from you, like what doctors are we talking about, et cetera, et cetera. But first of all, just your response to that story last night.
Rising anger, and it makes my blood boil, because these people, these politicians, are being completely disingenuous. They know perfectly well that the role of a public health doctor is exactly that. It's trying to prevent disease. So what a public health doctor does is try to intervene at a stage before the person has the disease. They look at things like alcohol, tobacco, unhealthy food, and they know that those three things account for 1/3 of all of New Zealand's health expenses. Right. And they're smart enough to know that if they deal directly with those three things in a preventative fashion, they can generate gains for community health, for the economy. Did you have any idea how cost-effective public health doctors are? So they're not like the rest of us. They are the best among us.
Right.
For every single dollar that is spent on public health, so on the work public health doctors do, the country generates roughly $14 essentially in profit, in increased worker participation, increased productivity, decreased social services utilization, and decreased healthcare costs. These people, the public health service, is a treasure. So people may not know what a public health doctor does. A lot of regular people might not have any idea, but you'll notice it when they're gone. So they're the ones who look after our clean water. So you've got 3 or 4 people that died in Havelock North due to Campylobacter poisoning.
Yep.
Fecal contamination in the groundwater. It's the public health service that looks after that sort of thing. Anti-smoking work, anti-alcohol work. When you go to an alcohol submission in your community where they're trying to open up yet another liquor selling venue, you will find a few stalwart community volunteers who've shown up on one side. You will hopefully find a medical officer of health who is a public health doctor, who, by the way, this is directly in confrontation and contradiction of what Simeon and Shane Retty and these others say. They have a legally defined role under health acts created by Parliament to do this work. They are specifically trained and have devoted their entire careers to looking after the preventative healthcare needs of communities. And so to vilify them as going off track or going rogue, to call them Muppets, which is what David Seymour said, Muppets that should be put back in their box, is a dishonorable, disrespectful, and absolutely disgusting comment from that man.
Hey, Gary, seeing you've brought that up, should we play? It's only 60 seconds. Let's play that
please.
Now.
Please, because I need to take a breath. I have nothing but disgust for these people.
If you need to take your earpieces out so you don't hear Mr. Seymour, feel free. But we'll be 60 seconds. So this is what David Seymour said today.
I also just note there's been a lot of commentary today about Simeon Brown's directive to public health doctors. Frankly, I'm far from the only one cheering on Simeon putting these Muppets back in their box. We've had far too much hectoring and lecturing about our private health choices by people who are supposed to be focused on public health. And when a true communicable disease, public health issue such as COVID came along, they weren't prepared. It is time to get public health focused on public health. That is things where one person's behaviour affects another, not trying to lecture McDonald's about whether they can open in Wanaka, which is really a private choice. If you don't want to go to McDonald's, that's fine, don't go to McDonald's. But public health is about communicable diseases and genuine problems where one person's choices affect another. If public health gets focused back on that, instead of hectoring and lecturing New Zealanders who have frankly had it up to here, then we're all going to be much better off.
There you go. 60 seconds of bile from Mr. Seymour today. Please continue, sir.
So some of what he said is absolute rubbish. He said something about we weren't prepared for COVID, right? Trying to blame that one on public health doctors. The world wasn't prepared for COVID. But you know who did prepare a comprehensive document for a respiratory pandemic in, I think it was 2017? It was the public health doctors. And it was an influenza preparedness document. They knew that sooner or later there'd be an epidemic, a pandemic of flu, and they prepared us for it in a way that a lot of the steps we took had been laid out in the work that they had done. And that work saved something like an estimated 20,000 New Zealanders. So this man is rewriting history. He's twisting things to suit his own political agenda. We know that. And he's ignoring the fact that these doctors have a legal mandate to fight against things that harm the health of the public. And as I said, a third of our health costs are from big tobacco, unhealthy food, including fast food corporations like McDonald's, and alcohol. And these are enormously profitable companies and corporations. And I really have to think that if he's not going to be on the side of public health and he's going to absolutely insult public health doctors, but not just insult. So think of what Shane Reti did. He fired or disestablished 1 in every 4 public health workers. He destroyed the public health service. That's the kind of thing you can't recover from, not in terms of morale or manpower or anything. He decimated that service. And again, these are the people that look after our clean water, our clean air, drug and alcohol addictions, which they try to minimize the harm from, not to mention outbreaks. So in the next outbreak, be it measles or whatever, their work is going to be absolutely critical. And we have these, I don't even think they merit the term politicians. They are ideologues who are hell-bent on defunding, destabilizing, and privatizing our essential public services in New Zealand. That can mean the New Zealand Defence Force, police, right? They said there'd be 500 more police, and not only did they not deliver the 500, I think they're actually, the numbers dropped by like 72 or 74. So we have less than what we started out with. They want to defund, destabilize, and privatize schools, right? The school voucher idea, where you hand taxpayer money to private corporations who will immediately siphon off some of that as profits, 10, 20 or more percent. That will be offshored. It'll go to investors and not end up delivering services to New Zealanders.